cluster of leadership behaviors called Challenge the Process is about recognizing that we can do better, that the status quo is not good enough. It's about challenging the way we do things because we find the current reality to be unacceptable or because we believe that we can do better. Curtis Burns, an asbestos inspector, is a leader because he feels compelled to act when he finds conditions that are unacceptable.
Challenging the process is something that we all have to do, but very few of us are willing to step up and do that. If you see that there's something that can be improved or done differently that makes something better, feel like you're obligated to bring that forward. A lot of people don't want to fight the fight. They want to come in, don't want to rock the boat, don't want to make waves. But for me, I feel like I'm obligated to.
Kathy Underhill, the director of a nonprofit organization that relieves hunger, felt the need to challenge the conventional thinking among her colleagues about policies on sugar-sweetened beverages.
I spoke at the American Public Health Association conference last fall when it was in Denver. They were doing a session on banning sugar-sweetened beverages for recipients of food stamps, and I was the lone dissenter. By stigmatizing or putting the magnifying glass on low-income people that are receiving public assistance benefits might not be the way for a national academic forum to react to the problem. That maybe they want to look at bigger level policy. They want to look at, can the big soda companies still get a tax write-off for dumping it into the food banks? Maybe they want to look at more education so that folks are making a different choice. But maybe they don't want to just cut off choices and stigmatize people.
Because of the circumstances, on a national panel at the American Public Health Association meeting, Kathy's example shows us that challenging the prevailing wisdom may take some courage, sometimes a lot, but challenging the status quo frequently means taking small or measured risks, as happens in the ordinary course of our jobs. For example, as an emergency preparedness coordinator, Christine Billings was asked to handle ordinary administrative changes, but they required her to take some risks to advocate for what she knew was right. In this circumstance, unexpectedly, she was asked to work in an acting capacity as a supervisor, and then to immediately participate in decisions about office space.
I took the initiative and the risk to really say that because of our relationship and the need for this relationship, that our group of 4 people would be best suited to really stay where we were at within emergency management, which hadn't been the thought process at all. It was consolidating everybody into one building, and that had been the train and the motion forward from that point. And so being able to step up and sort of challenge the process of everybody was moving into one building and say, hey, this doesn't work for us, our relationship is better suited, and the goals of the department to be able to respond to an emergency are better suited by really staying where we're at, and having the departmental director there and being able to be clear-spoken it was challenging for me individually because that's not a role I'm typically in. I've been in a higher level role for 2 days, and now I'm going to tell a departmental director that this is how it should be. And so with a valid argument and a risk taken, at the end of the day we were able to stay where we're at.
In these stories, fortunately, the legitimacy of the challenges was heard. The conversation on national nutrition policy was elevated to a more equitable and potentially more impactful level. And the local emergency preparedness staff were able to work in proximity to the other emergency response colleagues in the county, which facilitated their work. Challenging the process is for the purpose of creating a more ideal future state. Leaders look for opportunities and for innovations, and they also create opportunities and innovations to create a better future. Chris Fellens, a primary care physician, created a set of pilot strategies by which people who use the safety net system for healthcare can access the specialist they need.
There's a large subset of specialists or subspecialty types that patients without insurance or without Medicaid just can't access, period. And so if they have an illness that in theory could be cured or managed by having access to one of those specialists, they're out of luck unless they get a good insurance plan or insurance period.
Curtis Burns, the asbestos inspector, saw a circumstance that he found unacceptable, and he identified an innovative solution.
If there's a catastrophic loss, such as in a fire or water loss, those materials are damaged and it will release the asbestos into the home. Where the Victims Assistance Fund comes in as an example, unfortunately, I say unfortunately because part of my job duties is that I've had the responsibility of condemning people's products. As an example, I had I think it was probably a 28-unit building that had about 430 occupants in it, in terms of total numbers. We had a fire that took place in the most lower region of the corner of the building, and due to the thermal currents or the heat currents of the fire, it took that asbestos contamination for where the fire occurred all through the building up to the farthest point away from the fire. And we did some testing, and that testing had determined that all of those units contained asbestos contamination. Unfortunately, with this being a rental unit, I think maybe only 1 or 2 families out of the building had renter's insurance. Everyone else didn't. They were living day to day, paycheck to paycheck. I had to give them the bad news. And the bad news was that all of your contents are contaminated. And unless you have the funds to decontaminate them, I will destroy them. And the reason why I had to be that deliberate was because I could not allow for them to take that contamination, because then it would take it from their current location and contaminate someone else's building or hotel room wherever they resided. So that's why I call it a victims fund, because these people are victims, and it was to no fault of their own. They just happened to be at the wrong place at the wrong time and suffered the asbestos contamination.
Chris and Curtis are not finished. Chris is comparing those specialty care strategies to see which ones are the most effective and cost efficient, so the best ones can be institutionalized. Curtis is limited as a government employee in his ability to promote regulations needed for the Victims Assistance Fund. But people in the construction industry see its value and can move the idea forward instead. Chris speaks of the need to be flexible and patient when you are out there trying new things, challenging the status quo.
I see folks who can't be a little flexible as alienating folks that they otherwise could have really engaged in the conversation and maybe convinced to join them. It's one thing, there certainly are principles that you cannot settle on. But when it comes to this project, the most important thing is that it happens in some way, shape, or form. And so, I'm willing to be flexible and patient to make sure that I or other people have the opportunity to constantly bring this issue to the forefront, and until it gets addressed, or until the need gets addressed.
Chris and Curtis also acknowledge that while leaders need to take risks, they must also be cognizant of the amount of stress that the system can bear. Leaders take calculated risks, challenge at a pace that people can tolerate. Leaders expect more, but not more than the system can handle. When you fall on the sword of your ideals, you can no longer do any good.
I can only push as fast as the system, or push as hard as the system is willing to accept it. A lot of people think it's a good idea, but I got to have the right people in the right places making things happen.
Well, I think falling on your sword, obviously, it definitely detracts from what you're trying to accomplish, in that once you've done that, you can no longer accomplish what you were trying to work on.
create and sustain a culture of experimentation in their workplaces. By trying out new ideas, small wins can be generated. Even if things don't work out, an organization that learns from its mistakes learns that it's okay to try out new ideas, and its people feel safe to suggest and try new things. Mark Bullock, a director for the City of Glendale, draws on his experience over several careers when he reflects on the need for leaders to recognize when they need to change course.
When you go forward, the goal is that the difference is going to be a positive difference, and it may be that it isn't a positive difference, and then again, I think you have to readjust. That's the leadership part, is being able to go, that didn't work. We need to go to the right instead of straight down the path because that didn't work right. I think that's also part of that leadership part, is knowing that we didn't make it quite right. We've got to go this other direction.
One of the definitions of public health is the successive redefinings of the unacceptable. For example, it is no longer acceptable for a child in the United States to die of measles. We have affordable, accessible, safe, and effective vaccines to prevent measles. Asbestos exposure is now unacceptable. We know how to do asbestos abatement safely. With advances in science, public health and environmental health need to constantly challenge our current goals and benchmarks and how we do our work. This is one of the features of our field that is so exciting.